The neurologist was nice enough to have a consultation with my wife and I, in which he showed us the MRI of my mother's brain, and where his professional opinion was that my mother has onset dementia.
Well, I did care for both of my parents over a period of a little over 4 years.
My mom is 74, and she was my best friend. My mother was diagnosed with Parkinson's. It wasn't so bad at first, just her hands tended to shake and not really any big deal. I took her on a trip and we went to Alaska. It was just the two of us and it was this great time. And we're on the boat and we get to the top of the stairs. We'd been on a little daytime excursion. We get to the top of the stairs in the boat and she didn't know where we were. And she didn't know how to get to our room. She can still get around, but it's hard, and she pretty much needs a walker, or if she was shaking bad that day, she wouldn't want to go anywhere because she wouldn't want people to see her. It was a realization to me that I had to think differently about our relationship.
I think during the time I was caring for them, I was just trying to do, my best as a son, and I certainly found my role changing. I was becoming more like their parents than like their son, so it was quite a change and quite a struggle in my own mind about how these roles were all playing out.
We're so used to looking at our parents and not as people, and not realizing that they have their faults, they have their needs and their wants, and we may not always understand them.
To be honest, it is going to take its toll on me and my family. It already has. My
mother has good days and bad days, and some days she knows she's there and she knows she doesn't like it, and she knows that I know that.
I would like to sell the house and move on, but she's young, she's 74. I mean, I could see her going back to the house and living for a long time. I don't know. So I don't know what's going to be. I don't know what's going to happen.
And there's some days when she's talking about the same thing over and over and over again. And I feel like I'm dealing with a small child, and I just tell them what they want to hear till I can kind of back out of the room and have a non-conversation with a grown-up and go on about my business.
And it really is a battle about the guilt part of not wanting to go visit and keep her company, because she just sits in there and watches TV, and it's hard for her to get around, but yet I don't really want to go over there and push her around South Park Mall today, so that's the hard part.
You ask, what's the takeaway from this? What is this supposed to be teaching me? What am I going to learn from this?
I couldn't have done anything better. It's just to recognize what their needs are and to step up and fulfill them.
The scary part is it's telling me that maybe my priorities are screwed up.
Get your parents to create for themselves a health directive and have them sign a medical power of attorney.
Definitely have all the paperwork in place and have that conversation with them, and if at all possible, try to set things up so that you're in the same city.
You're going to feel guilty, you're going to feel worry, and you just have to deal with it, let it go.
I don't have forever, and I better get my act together, or I'm going to be irresponsible and not be prepared for my own retirement and be a burden to my children.